my goal is to start my own practice, and I've come up with a unique way of doing it. Honestly, a lot of people think they know what a dentist is, but there's just so much that goes into it.
Hello everyone, welcome to episode 4 of the video podcast series. Today's guest is a fellow Trojan, Dr. Melkon Avetisyan. He graduated from USC Dental in 2022. Before dental school, he obtained his bachelor's degree from Cal Poly Pomona and then obtained another bachelor's degree in dental hygiene from University of the Pacific. In this podcast, he talks about his non-traditional route into dentistry and life as a new dentist, which includes his current project, a startup dental practice. Please like and subscribe if you haven't already. And now onto the video.
Thanks for having me on here, Eric. I'm Dr. Melkon Avetisyan. I guess my dental journey started a long time ago. My earliest memories are of me looking into my, immediate family's mouth as a little kid. I don't know why, but that's just the earliest memories I have. And so I think that might have dictated how I ended up here. I was a hygienist before becoming a dentist, but my journey started way before that too. I think I was maybe 16 when I started to volunteer in a dental office. And so it's gradually gone from being like someone who shadows and then kind of doing DA on the side to now being a practicing dentist.
How did you end up volunteering at this dental office when you're 16?
Yeah, so like I said, I kind of always had an interest in dentistry, so I wanted to, take baby steps towards it. I found a local dentist and I was like, hey, if you have any time, I'd love to stop by and just ask some questions and kind of get a feel of what dentistry is about. Because honestly, a lot of people think they know what a dentist is, but there's just so much that goes into it. Like you said, there's a hygienist, there's an assistant, and all kinds of different auxiliary roles that go with being a dentist. And as a dentist, you have to truly understand all of it, or else you think all you do is drill and fill teeth. And, to me, that doesn't really sound exciting.
Yeah, definitely. So you were looking into people's mouths when you were a kid and you're like, I'm interested, I need to go reach out. And then some dentist allowed you to volunteer for him when you're 16.
Yeah. So it was really neat. I mean, I think a lot of times this is what most dentists have in common is they're really friendly.
Yeah.
They always love when people ask them about dentistry, and they're always just eager to share that with, new people. So I think, especially for pre-dents, just go and ask. You never know what will happen. You might end up getting a job one day. So it's just a really neat way of getting experience, getting a first person look of what your future profession could be. And you might not like it. So you never know. So I thought it was a fun way of spending a couple of, hours a week there. And one thing led to another. And here I am.
Cool. So you did hygiene at UOP. Did you do all of your undergraduate studies at UOP, or where did you do your bachelor's, or did you do like half and half?
Right. So my road to dentistry was long. I actually did my undergraduate. I started at a local community college, and then I transferred to a college here in Southern California called Cal Poly Pomona. And that's where I graduated with my BS in biology. I had basically, from graduating undergrad to starting hygiene, I had about a 6-month gap because my hygiene program actually started the spring after my graduation from undergrad. I did not do all of my education at the same place. I've been at quite a few different schools.
Yeah. So now let's talk a little bit about hygiene. So was hygiene always a goal at this stage, or was being a dentist always a goal? And then you thought you would do hygiene as a stepping stone. How was that process?
Yeah. So honestly, I had never thought about doing hygiene as a form of a career or even a pathway to get into dentistry until it kind of made sense. So I'd applied twice while in undergrad to dental schools, and I wasn't having any luck. So I know there are a lot of people in that position, and it's tough, right? You feel like smart enough. You feel like you're lacking in some areas, maybe academically, or when it comes to volunteering or things like that. So it was frustrating, but I knew I had a passion for this, and I had enjoyed my time in the dental office that I was shadowing and assisting at. So I said, okay, maybe it makes sense to try the hygiene thing. And So there's two different types of hygiene programs. You can do the associate or you can do the bachelor's. So I chose to do the bachelor's, and there's one program, like you mentioned, at the University of the Pacific that's sort of accelerated, and so you
Mm-hmm.
can start in the spring semester rather than like the typical fall semester. So it goes from spring to spring, and so it kind of made sense with my timeline, especially knowing that I most likely wanted to pursue dentistry going forward. Um, but I truly didn't know what hygiene was about or what the program and the kind of education around it entailed. So that was actually really interesting. So when I got to that point in my education, I was like, hmm.
What am I doing? So did you enjoy hygiene or not really because it was a huge surprise and was it
Right.
harder than you expected? How was the
Y-
program?
Hygiene programs are within the hygiene community are known to be quite difficult and for good reason. And now having gone through both a hygiene program and a dental program, I think there's a bit of kind of like a boot camp feeling when you get to hygiene because it is a
Mm-hmm.
shorter program and you have to learn quite a lot and both in your hand skills as well as didactically. So it's just it was a very much of a shock for me. So, you think your undergrad is difficult, right? You take your science courses and all that, and you're like studying for the DET. You're like, oh, this is hard. And it is. But when you add kind of those type of courses on top of having to learn hand skills and patient management and all other, radiology and these things, it in a very short amount of time it becomes quite the challenge. And so, yeah, when I first got to hygiene, I was like, whoa, this is like not what I thought it was going to be. And you really get thrown in there. I mean, first week we were already doing head and neck anatomy and we were doing, I don't know, embryology and all these difficult science classes. I'm thinking like, I thought I was going to clean teeth. This isn't what I signed up for. I thought this was for dental school, but it was, yeah, it was definitely a good wake up call. But having said that, I truly did enjoy it. There's aspects of it that was a big surprise. You learn so much about how a dental practice is ran, right? You learn front desk stuff, you learn back office stuff, sterilizing and kind of managing schedules and keeping an intake of all your supplies. And it was, at least in my program, we were kind of thrown into different types of rotations during the week. So sometimes you weren't actually doing clinic, you were just doing more like office staff work. And so it's really interesting because in dental school, we didn't do anything like that. So
Yeah,
I think
definitely.
there, yeah, there's a lot in hygiene that isn't necessarily in the dental program. So I think it was a great supplement for me.
Did you feel like you were a lot more prepared for dental school after finishing hygiene compared to a
Yeah.
dental student who didn't do hygiene?
Yeah. So, in our class, we had about 140 students, and I believe maybe 8 or 9 of us were hygienists. I believe I was maybe 2 or 3 of the hygienists who actually had working experience prior to starting dental school. I would say definitely. And the reason why is, you start dental school, and especially if, pre-dents who aren't there or for people who haven't been in dental school, like first week your professor's already talking dentist to you, right? They start to say the mesial of this, the buccal of that, the cusp, the this nerve, and that periodontal ligament. You're like, what are these words? And so
Mm-hmm.
you don't really get babied around, and so I'll be honest. I think first semester, me and those hygiene students or anyone who had maybe an RDA background compared to anybody fresh out of undergrad, it was night and day for us. Like, we were sitting there saying like, oh, this is boring. We know what the mesial is. We know what tooth number 12 is. And everybody else was like, oh my gosh, I have to write this down. Like, I can't keep up. And I'm like, oh, okay. So you kind of notice that. So I think early on in dental school, it was a huge leg up. There was a lot of things that I can skip over and not have to study as rigorously than some of my other classmates who were, seeing it for the first time. I wouldn't change it. The education I had in hygiene that, transitioned with me to dental, I think was irreplaceable. And so I'm not mad or sad about the route I had to take to get there.
Okay, yeah, that's good to know. You're more well-rounded, you have more knowledge. My roommate, also a dental student, Joanna, she was also a hygienist, and
Hmm.
now
Hmm.
hearing you talk about this reminds me of being like in Dr. Monier's class looking at the teeth, and I couldn't tell if it was a tooth on the upper right or the upper left. I was so confused, and Joanna just knew. And I was like, I don't get it. I don't understand what's going on. So
And then
that's
like
good that
think
you had that
about
extra
now.
background. Yeah, now I know.
Yeah, and think about it exactly, right? So that's kind of how we feel. We're like, oh, we've already seen this so many times, so it's nothing new. But it really does make a big difference. So yeah.
Yeah. So let's talk about some pros and cons of being a hygienist while in dental school. So one of the pros
Hmm.
is you have all this extra knowledge. Another pro I can think of was working. You mentioned you worked a little bit before dental school.
Hmm.
I think you might have worked during dental school a little bit. Did you? And then how was working during dental school as a hygienist?
First, for pros and cons. So yeah, one of the biggest pros is you just come with a few things already built in, right? So, for instance, indirect vision. I remember when you first time are introduced to indirect vision in dental school. It's almost like you're playing a game. They give you this little block or something, and they tell you to write your name, looking at the mirror, going kind of like backwards. So, but again, for a hygienist who maybe even worked, you're like, indirect vision, that's like normal vision for me. So yeah, exactly. So little things like that, it's already built in for you. So you're starting, and you're not starting from zero, you're starting at maybe 4 out of 10, right? Your
Yeah.
skills, because you still have to learn how to use a handpiece, and getting adjusted to the speed, and how each type of burr cuts and things like that. So there's that. But the actual, like, fundamentals are there. We had a fulcrum. You guys didn't know what a fulcrum was, right? So it's like little things like that definitely gives us an edge. Some of the pros are, hand skills, prior dental knowledge, whether it's anatomy, morphology, some of the other science courses that are related to dentistry that both hygiene and DDS students go through. Other things are working, right? There's a possibility of working, and not every semester in dental school that's possible, and not
Hmm.
for everybody. I know a few of our hygiene classmates never worked in dental school, but that's because it wasn't a priority for them. But that's a flexibility, right? So making some extra cash never hurt anybody. Plus,
Hmm.
you're getting patient care experience that other students aren't necessarily getting, because you're limited to whatever clinical experience you get in dental schools. I also think, you get a little bit of networking, because we have large hygiene organizations, right? Like, for instance, we're in California, we have the CDA for the dentist, and then we have the dental hygiene, the CHDA for hygienists. So there's a big network for you to, meet people both in your exact profession as hygienist, but also for other dentists and things like that. So there's a little bit of a head start in that area as well. You also kind of get exposed to organized dentistry early on. I know a lot of my classmates did like the CDA rep or the ADA rep. So you get to kind of go around the country, meet other students and whatnot. And these are all things we also do as hygienists. I remember I was part of some legislative work, and that was really fun to see how they kind of like pass the bills and bring forth new motions for whether it's the scope of hygiene or practice, things like that. So that's really cool to see as well. For cons, I think you can maybe become complacent sometimes, thinking like, oh, I already know this, I know how to hold a mirror and things like that. So you might slack off on your lab work, which I could have been guilty of once in a while, but that's one problem you run into. Another problem is you can maybe learn some bad habits that then when you're learning new skills or new didactic knowledge, you might be more stubborn about changing, right? So, like, let's say you were taught in your program that to treat XYZ, you do this. But now
Hmm.
new research has come out, and it's like, well, you got to do like this. And I'm like, okay, I have to change my mindset. For instance, for me, it was the way you diagnose periodontitis. So when I
Hmm.
was in hygiene school, it was done a certain way. And then when I graduated, and
Everything
started dental
changed.
school, they're like, no, we do it different. I'm like, oh, are you kidding me? I spent the,
I spent all this time learning in
exactly.
this one way.
Exactly. It's like I got really good at it. Now it's really easy, and you're like, oh, now I have to change the whole way I do it. But at the same time, it's also nice because you are learning, more modern techniques, and you're learning, up to date things that are, cutting edge in your industry. So that's, I think, the biggest con for me was having to kind of relearn. You're like, I already spent time learning.
So, for someone who wants to go to dental school, would you recommend this route specifically to someone, or would you recommend kind of the route you took? I'm going to try to apply first, and if it doesn't work out, do this route as an alternative route, or would you, knowing everything you know, recommend it as for some
Yeah.
people, do the hygiene route and
hmm
then go to dental school if you're like not sure you want to be a dentist?
There is no right answer to this in the sense where I know some programs used to do sort of a bridge where you can apply to the hygiene and they would do consideration for you to then move on to DVS program through that. But the reality is it's not for everybody because
Mm-hmm.
hygiene is, like I said, like it's quite rigorous, and there's some part of it that's honestly more difficult than dental school because you're being more micromanaged in a sense. And it is a shorter program, so there are a lot more things expected of you in less amount of time as well. And not to compare the two, I mean, they're both, rigorous in their own ways. So it's not like a cakewalk where you're going to be like, oh, this was so easy. I can't wait to do the next 4 years. So it's just something to prepare yourself. Now, having said that, it is a great option if one, you are unsure, because I know plenty of hygienists who go become hygienists, work a few years, and say, you know what, I think I want to be a dentist. Like, I really enjoy this, and I want to move my career forward, which is great. Um, I also know a lot of people who do it and go like, me, I kind of like working 2 days, 3 days a week and making good money and having no responsibilities, because that's the next step. Is as a dentist you have more responsibilities, there's more expected of you, your license carries more weight in the sense of prescription, so distributing drugs and doing surgery and having more responsibility as the main figure in that office, right? I wouldn't say I recommend it, and I wouldn't say I don't recommend it. So I would say each person should do the research, talk to people like me, right? If you know someone who did both, ask, was it worth it? Is it a viable option? Because it definitely is. It helps your resume, right? Like I said, it gives you a lot of um, technical and didactic knowledge coming into dental school, so it doesn't hurt you, but it's not going to be an easy road. So
Mm-hmm.
you definitely have to be ready for that if that's what you want to do.
So
Yeah.
now that you finished hygiene a while ago, you even finished dental school, now you've graduated. How's life being a new dentist? Earlier, you mentioned that one of the pros was networking. And I believe that,
hmm
correct me if I'm wrong, but the job you currently have as working as a dentist, you got from networking as a hygienist, correct?
So I basically work where I was a hygienist. Yeah. So that's one of the perks, right? It's like if you are known for being a good hygienist, you're probably gonna also be a good dentist because there are certain skills that are transferable between the two. Patient management and hand skills. It definitely helps. Because I know one of the tough things when you're graduating is, well, how am I going to find a job? So there's so many different ways, and that's a whole other conversation, which we can have if you like. But actually, I finally retired my hygiene license, so I was excited about that. But now I got to work as a dentist for a long, long time before I can retire that.
Yeah.
So, so that was a fun, little exciting thing. But yeah, working as a dentist it's been good. I mean, it's so different from school, right? In school, things are kind of um, sort of mellow because you do see, one patient and you're given about 4 hours for that treatment. And sometimes treatment could be as little as just taking medical history because things are so complicated. And by the time faculty comes around, you can feel like you're not being very productive versus when you get out, it's like within 1 hour, you're maybe seeing two patients, right? So it's just um, a lot of adjustment that has to be made. And I think the biggest adjustment really was comfort level. Like I remember the first, day you're like treatment applying, you're like, oh my gosh, like, like I hope I treatment plan correctly, right? Because you can't just go back and be like, oh, by the way, like maybe we should do this. And you're like, what? You told me, 2 months ago that this is what I needed, and now you're telling me, I need this. So, um,
Mm-hmm.
for me, as like a new grad, that was, the biggest fear factor, if you will, was just like making sure I'm treatment planning correctly because this is something that's going to haunt me for the next few months as we go through treatment. Especially if it's not just one or two little
Yeah.
caries that you have to take care of. But it's like, oh man, like is this RCT or do I just do like a clean out and see how it is and blah blah blah. So it's just a lot of things that you work through as a new grad because you just don't have the experience.
Do you feel like you've been haunted by things? Like, for example, in dental school, we didn't see too many patients. I feel like I wasn't haunted by things. Now, being a dentist, I see so many patients that in the back of my mind, I'm thinking, oh no, I should have prescribed antibiotics, or oh no, I forgot to floss that one tooth. Or like, do you think about these things now that you see more patients, or do you just leave work at work and then go home and you can relax?
Yeah, that's actually a good point because like as a hygienist, there wasn't too much like haunting of patients, right? Like they don't come back and go like, "Oh my gosh, like you really missed the calculus there." That really wasn't a thing. I mean, once in a while they might just say like, "Oh, like can you just polish a little better? It doesn't feel as, shiny." So that's fine. But yeah, as a dentist, there's definitely that added pressure where, let's say you do filling, it's a little high, right? You adjust the occlusion, but that's a little high, and then they come back 2 days later, like, "Oh my gosh, I'm in so much pain." You're like, "Oh, let me just," and that's it, right? It's an easy fix, but
Mhm.
the patient doesn't know that. So, yeah, I mean, there's a lot of stress because whenever you have a patient come in, they're like, "I want to see that doctor that I saw 2 days ago," and you're like,
Oh
what happened?
no.
Oh my gosh!" Like, what? It really depends on when you work, where the location, right? If it's like a big corporate office and they're pushing for a lot of procedures versus the private practice, and it's very, very patient centered. It could be something in between. So, depending on where you sort of end up and the kind of experience you have, I agree with you. Like, it could be scary. There could be days
Yeah.
where I mean, there are days where I'm like, "Oh my gosh, I hope that, like, RCT actually, like, went well." Like, I'm a little worried about it, but we'll see if in 2, 3 days the patient calls. So there's a lot of that, baggage that you do take home. But I think as we progress and get better and get more experience and start to really see the whole picture with our patient care, I think it's gonna get easier. But right now, there's definitely that.
I definitely feel that. I think it's getting better though. Now that I'm
Mhm,
6 months or 8 months into
mhm,
working as a resident dentist, it's
mhm.
improving, but that's a huge difference I noticed from dental school. So you found this job from being in hygiene. How was that transition? As soon as you graduated dental school, did they consider you a dentist and you started seeing patients as a general dentist instead of just doing hygiene? Or how was that transition?
I was still working as a hygienist until I got my license, which happened sometime in the summer. So it wasn't like too far out. But the transition, like I said, wasn't hard because I was already there and patients knew me. But it was more of like changing responsibilities. Right now, I
Mm-hmm.
wasn't the hygienist sort of carrying out treatment, but now I was also like dictating what the treatment should be. And I still do quite a bit of hygiene here and there. So it's not like I've cut it out of the schedule, but yeah, there was just now an added responsibility, and so that transition took a while. I mean, I'm still getting used to it, like I said, with things haunting us. But yeah,
Yeah.
it's been fun, and I mean, now I get to do like more procedures that I'm really interested in, and some cosmetic things and all that. So, but I always, the number one thing is the hygienist in me. Always going back to the preventative and you know telling patients how to take care of their teeth, which I think sometimes dentists kind of overlook because they were not a hygienist. So I'm kind of still doing
Hmm.
my spiel. So that I guess hasn't transitioned. It's just stuck with me. It's just something that I don't know if I'll ever let go of.
Prevention is good. That's good that you do that. So earlier we were talking a couple days ago, and you mentioned you're transitioning your career and you want to start your own business. So you mentioned this shared practice. It's a startup practice. So you mentioned
Yeah.
you're basically going to be starting your own practice. Can you tell us a little bit about that? And this is, for me, this is mind blowing. This is super awesome because I feel like we just graduated. So like that's cool that you're already moving. It feels like you're moving
But
way ahead of us.
well, I don't think so. I think everyone is doing exactly what they need to be doing. So
Yeah.
I always knew that this was my goal. My goal is to be a practice owner, and whether that's multiple practices and whatnot, that's the future. But for now, my goal is to start my own practice, and I've come up with a unique way of doing it. And it's not like the model I've thought of is very special. I mean, a lot of dentists do this, but usually as a startup, that's probably not something that's done. And so, like you said, shared space. I'm looking into leasing from an existing dentist just the operatory space.
Hmm.
So it's not like I'm buying a practice. It's not like I'm becoming an associate. This is going to be a completely separate practice within a practice. And the reason why I thought of this is because it's a very low risk way of doing a startup. I don't have to build anything out. I don't have to purchase anything. The only thing I have is basically my monthly lease from the dentist I would be taking the space from. And the reason why this is difficult to do as a startup is because I have no patience, right? I have to start from zero. So there's that risk you're taking of basically having a space and not having anyone in it as a patient.
Mm-hmm.
Typically, this is done with dentists who are maybe kind of like going towards the later stage in their career and they're not interested in having like a big practice. So what they will do is they'll take space from someone else so they don't have a big mortgage, but they still have their patients that they can see. So it's like a slower way of calling it quits without having a big overhead. So I'm doing it in the beginning of my career.
That's exciting. How did you find this? Did you just look up on Google shared spaces, or did you know someone, they mentioned it and then you reached out to
Yeah,
them? How did this
yeah.
happen?
Yeah, so yeah, no, I mean, I literally was just online looking and I found the ad for this. But yeah, I mean, Facebook groups, other dental kind of like blogs, even you can even use like a real estate broker who does like medical spaces, and you can ask them like, hey, I'm interested in this. Do you know of anybody? And like I said, this is part of that networking, right? So it's like you
Mm-hmm.
meet more and more people and you share ideas, you share things like, hey, this is what I'm interested in. They're like, I know a guy who's maybe looking to retire, or I know a guy who has like a really big space, right? So these people exist. And so
Yeah.
if you got looking and you're asking the right questions and you have the right ideas, it's very easy, not easy, but it's doable to kind of start your own business. You have to really know how to run a business, what it takes to start a business, the cost of running a business. I think the one thing dental school really did not do a good job of is that
Mm-hmm.
aspect, right? We have a kind of practice management course that we get, but it's really super surface level. And you maybe talk about what an insurance is and what your malpractice is, and that's like where it stops. And you really don't understand like how to evaluate a practice, how much is a good price to pay for it, what are ways to finance to purchase it, and so forth. So there's just so much that is kind of something that you supplement outside of school. And I think a lot of people just haven't done that yet or aren't quite there yet. I think that's why this seems like, oh my gosh, like it's so early. But I've been kind of putting in the time and learning and preparing to go this way. So I feel ready. Yeah.
Mm-hmm. That's good. Talking about finances, did you have
Mhm.
to put a down payment for this? Or like, I'm assuming since you're renting a space, to me in my head, I'm thinking like you're renting an apartment in a building, except it's smaller. You're renting like a chair or like a suite in a bigger practice. So like if you rent an apartment, you would have to put like first month and last month's rent, and then you pay your rent every month. How is it for this? Did you have to put a big down payment? Did you have to take out a loan from a bank? I'm assuming you have student loans. Actually, I'm not completely sure if you have student loans from USC. If you did have student loans, did it make a difference with this bank loan that I'm assuming you got?
Yeah, I do have student loans. No, that part didn't affect what I'm doing here, and which is why I'm doing it the way I'm doing it is because I don't have to go to the bank to get a loan for this. Because, like you said, it's basically like an apartment. You don't need this massive sum of money to be able to rent. You just need
Hmm.
a little bit, right? So when you hit the nail
The
on the
nail on
coffin
the
there.
head.
Yeah, exactly. You just there you go. It's just super easy. Like I said, low risk. You don't really have to get the bank involved. So this is why I'm going this route because it's a very low financial liability for me. Versus if you were to buy a practice, then Erica, we're
Hmm.
talking about you have to evaluate that practice, and it's probably going to be a few $100,000. Then you have to go to the bank, and then you have to show proof of X amount of money in the bank so you can, get the loan for it and blah blah blah. So there's a lot that goes into this. And so
Hmm.
that's where I was kind of thinking about, why not try this? And if it's feasible and it's successful, then I can think about purchasing a practice later on with which which would then be, more affordable, if you will. It's a big risk to take, right? If you're buying a practice right off the bat, it's a lot more on top of your student loans, and then you probably have to get a co-signer and so forth. That's where my thinking was as I was coming up with this idea.
So earlier when we were talking, you said you were planning on working here probably just 1 day a week and then seeing how it goes and then working a little bit
Hmm.
more.
Hmm.
So does that mean you're going to work at the practice you're currently working at 4 days a week? And are they
Hmm.
aware of it, or are you just going to see how it goes? It's hard to like tell the person you're working for, oh, I'm slowly going to leave.
Yeah, so no, 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 that's a good point. And honestly, like with dentistry, it's really interesting because a lot of times when you work somewhere, they might make you sign a contract that has a clause in there that says, if you ever stop working here, you can't open a practice within X miles. And,
Hmm.
you obviously, per the ethics, of the state, you can't just, take patients with you by saying, hey, I'm leaving, come with me. So there's a lot that you have to be aware of. I was upfront. I said, this is my goal. I want to slowly start doing this. It's it's been totally okay with my current, office that I work with. We're on good terms, and they know like I'll be working with them for a long time. And again, they get 4 days, so it's not like gonna cold turkey it. So they get more days than I'm doing for myself. But it's also part of my business strategy because if I had started with many days, then I'm taking again another financial burden of having to sacrifice guaranteed, paycheck to do what I want to do for myself. So again, these are things that you have to be thinking about, right? It's like, well, if I stop working, that also means that I have to my business has to be very successful right off the bat. Very fortunate that my current employer is totally okay with it, and that's not always the case. And like I said, if you work somewhere, you might be signing a contract that says you can't, compete, within X miles. So those are things you need to be aware of if this is something you want to do. So I think a lot of times young dentists were just eager to get a job, right? It's
Hmm.
exciting. You finally get a paycheck and you're like, oh, this feels good. But you gotta really be aware of what you're getting yourself into. And there are a lot of great resources out there. There are podcasts or books, just forums that tell you like, here are some things to look out for. As you're signing your contract. I really encourage, new grads or young dentists to always keep that in mind.
I'm so excited for this new thing you're building. So thanks for sharing that with us. Now we're going to start wrapping it up. I don't want to take up too much of your time. So are there any final words you want to leave us with? You mentioned some books and some podcasts. Any specific ones that have helped you to get where you are today?
First off, just help others and they'll help you too. So just, as a dental community, um, we should be an open book. So if people have questions and whatnot, like feel free to reach out. And it's not like we all know everything. We're always learning. Just like you go to CE courses, we all have something new to learn every day. So that's my first advice. Ask, learn, always be open to that. To some podcasts, one that I listen to a lot is the Dentalpreneur podcast by Dr. Mark Casas. and I believe one of our classmates actually works for him. So small world. He's
Hmm.
really good about the business side of things, but there's so many different ones where they'll discuss the actual treatment type of things. Some will just discuss about how to build a practice, how to physically build it, versus some will tell you how to like run the practice. So a lot of resources out there, and those of us who commute to work, which I do a couple of days a week, it's long commute, so I just listen to it. And then other than that, just for the new grads, it's an exciting road ahead. You can be in a GPR, you could be in prior practice, you could be working for a DSO. It's a big world out there, and you kind of have to maybe see what works best for you. And you might be surprised in a good way or a bad way. I don't know, but you'll be surprised. And don't ever compare yourself. Lastly, if you are doing a residency, then that is what it is. And if you're working in private practice, that is what it is. And if your goals are to be a practice owner, then you know take baby steps, and hopefully that will work out for you.
Well, thank you so much for doing this video podcast with me.